Let's talk about the measures that the health minister announced today as part of the ways that we're dealing with this monstrous virus. Fred.
Well, indeed, they've improved contact tracing, and what will happen from now is that if anybody is exposed to someone who's tested positive, what will happen is that the person will be tested. They will not just look at those who meet case definition. They will test those persons to be sure that they are free of the virus, and in most cases they do double testing. If you test negative this time, they will test you again after a period of time, just to be extra sure. Right. And that's how come there's some clarification being given about the number of recoveries that we've had. Yesterday, the health minister had mentioned that 31 persons, and even today he had mentioned that that number has even gone up to 38. But the point remains that the experts would want to do double checking before they finally clear these persons. So we can hear the health minister explain these measures and how they are undertaking the enhanced screening.
Let's go for it.
UGMC, University of Ghana Medical Center, that is ready for use. Training has been completed. There are 14 beds for holding area and 14 beds for treatment. 5 ICU beds are also ready. So we have UGMC dedicated, again, some part of the facility to put in patients. Bank of Ghana Hospital. I kept on telling the community, the people in Ghana, that the Minister of Health hasn't got direct jurisdiction over Bank of Ghana Hospital. And people were blasting that there are hospitals completed that will not be utilized and all that. We have had engagement with Bank of Ghana, and they have released 2 floors that will take care of 20 beds for our use. Because the facility doesn't belong to the Ministry of Health, Bank of Ghana has agreed that their own people and some VIP personnel will be allowed there. So in case we get some of you here, VIP people, we are likely to take you to Bank of Ghana Hospital. Why are you laughing? You are all VIP people. In this material, okay. So I'll underscore the fact that we are ready to take people in and make sure they are getting well.
Right, so that's the health minister there, but
indeed,
he's talking
he was talking about the health facilities. Right. He talked about some new facilities that would now take the persons. The East Hospital, for instance, has a capacity of about 100. It's now taking about 50. And so the Bank of Ghana Hospital is also giving a part of the facility which will take about 20, and then the University of Ghana Medical Center is also taking part of it, and so it improves the health facilities that we have. You recall during the peak of the Chinese crisis, the coronavirus cases in China, they had to build new hospitals within some record time. Yes, Ghana doesn't have to do that because we don't have that many numbers, and so the facilities what we have are enough. But the minister also talked about the measures, the enhanced testing that I talked about. So we can hear him address that issue now.
Okay.
So far, we have deployed several teams in Accra and Kumasi. They are working now. And people that are being contacted are cooperating very, very, very well. And we believe if you are able to do this exercise successfully, the chain that we want to break will get broken and we'll have no challenges in our country. That is the exercise we have mounted. The necessary materials and logistics that these teams need have been given. They are going around with security officials and immigration people and disease control officers in the districts, epidemiologists, the field officers. They are all part of the teams that are moving. And we believe that with your cooperation, things will be okay for us. We will continue to give updates on the type of numbers they are reaching up to. In Accra, we now have 140 teams in the areas that we have demarcated to actually trace people in. So far, between Monday and Tuesday, they had contacted 635 people, and 589 samples have been taken. They have all been sent to Noguchi. We have also started testing in Kolebu, the infectious disease reference laboratory. So the tests will now become a bit larger and results will come a bit earlier. In Kumasi, we have deployed 40 teams. They started a bit late yesterday, but they have contacted 160 people and they have collected 22 samples. We are pushing them to up their game today so that they can get closer to the targets we have set for them. Things are working for us. The good news is that some people are being contacted on telephone to try to find their locations, and they are also cooperating. Yesterday, somebody called me and praised government on the efforts that we have put in so far. The person came in earlier, before quarantine. He had been called on telephone, contacted, they've given her where she should go for her sample to be taken. She went there, they took her sample, and she was so happy awaiting the test results. Not just one isolated case. So the contacts can be physical, one-on-one, can be on telephone, but we request that Ghanaians should cooperate with us, and we believe we can break the chain.
So that's the health minister there explaining, Fred, the tests. Then the fact that we need to, the more tests you conduct, the more you get to know how many people have this condition.